I'd just like to introduce our speakers. So we've got three speakers today, but they're not going to do an hour each. We are going to keep to time, fingers crossed. So welcome to you all from our Future Health. Kate Harvey is our Future Health's Head of Participant and Public Involvement. She manages the Public Advisory Board and Involvement Network, and previously worked at Genomics England in engagement and ethics research roles and the Nuffield Council on Bioethics. And also Caroline Collins, who's a Strategic Partnership Manager at Our Future Health, working to increase brand awareness of the programme and reach diverse audiences. And before this, Caroline worked for Prostate Cancer UK and the Fair Trade Foundation. And then we have Anna Curson. Anna is Strategic Partnerships Manager at Our Future Health. Says you've worked here for nearly 2 years, and before that at the open research publisher F1000, but spent the majority of your career at Wellcome, leading major partnership ventures. So we've got some fantastic speakers here today. Very welcome. I will stop sharing my screen and we will hand over to the people you've come to hear speak. Thank you.
Thank you, Abby. I'm going to attempt to share my slides. So this is usually the first area of technical problem, but hopefully you'll all be able to see those. Let me just put them into presentation mode. Right, hopefully you can all see those correctly. I'm going to hand over to my colleague Caroline in just a moment to kick us off. But just before doing so, I wanted to just say a huge thank you to DEBRA for inviting us today. Our Future Health is a truly kind of collaborative venture across the whole ecosystem, really, from the kind of general public through government, through NHS, and through charity and industry partners as well. And DEBRA is one of our affiliate charity partners. We have 25 affiliate charity partners at the moment, one of which is DEBRA. Our affiliate charities don't provide any funding to the programme, so later you'll hear a little bit about our funding partners, but they do put their brands alongside ours in the public domain, and they help us to engage with general audiences, to build trust and confidence and understanding about the programme, and to help us meet our ambitions of bringing together 5 million people. And they also bring extremely valuable expertise and access to research networks and communities. So we're really grateful to DEBRA and all our other affiliate charities for all the support they provide, and we're really pleased to be here today. So without further ado, I'm going to hand over to Caroline.
Thank you, Anna. Okay, you can flick to the next slide, please. Lovely, thank you. Welcome firstly to all the DEBRA community on the call. And I'll start today, give you a little bit of background about the programme, what it is, why it's important, and if you would like to, how you can take part. Next slide, please. So we're going to kick off today with just a little poll. So we're just interested to know if anybody has perhaps already heard of Our Future Health. Maybe some people have already joined the programme or signed up to be a volunteer, and perhaps this is the first time you've ever heard of us. So if you'd like to, it's highly voluntary, but fill in the poll that's come up on the screen. Give that a few minutes, and then Abby will kindly share the results with us. It's always interesting to know how well known we are outside of the researcher community.
I haven't quite had everybody yet participating. Come on, the last couple of you. Pop a response in. I think I'm going to have to end it to share it, but I shall do that in 3, 2, 1. Share results. Can you see that?
Yes, we can see that. Yes, thank you. So it's not unusual to see that the majority probably haven't heard of us, but by the end of the session today, you will be well informed. And then we have some people that are a participant, which is fantastic. So thank you to them. So yeah, brilliant. Thanks, Abby. That's great to know.
That's my pleasure. I realise I should have answered yes, and I am a participant, and then I might have got a gold star.
Ah,
Thank you. I'm going to
fantastic.
stop sharing the poll now.
And thank you. Okay, next slide, please, Anna. Okay, so what is our future health? Why is it important? And what could it mean for research into both common and rare diseases and conditions in the future? Next slide, please. So our Future Health is the UK's largest and most diverse health research programme. We're building a community of 5 million people, and that will create a unique resource to help develop new ways to prevent, detect and treat both common and rare diseases and conditions, with the ultimate ambition to help everyone live longer and healthier lives. Next slide, please. So Anna talked about the fact that we have funding partners. So we're funded, and it's a collaboration between the public, health research charities and life science companies. And around 2020, we received over 200 million in government funding from the UKRI, UK Research and Innovation. And earlier this year, we received confirmation of further funding of up to 354 million, which really demonstrates the importance of our future health and that the confidence the government is showing in not only our mission, but that are also our ability to deliver on that. And we're also proud to be affiliated with many health research charities, as Anna mentioned, like DEBRA, that represent so many diseases and conditions that people live with in the UK today. And there are also 5 funding charity members on the screen there who play a larger role in the programme and sit on our founders board. And of course, our industry partners at the bottom there, who bring vital expertise, experience and financial support. And with a research programme of this scale, it would be very challenging to do that without any of our partners. Next slide, please. Thank you. So what is it really about? So researchers can work with our future health data to discover new insights, test innovative approaches, and improve ultimately how we can predict, detect, and treat diseases and conditions. Of course, earlier detection will lead to more effective things like screening, prevention programs, and more timely treatment. And it will help us to develop new ways to predict those who are at higher risk of disease, ultimately leading to better and earlier treatments, and therefore, of course, leading to better outcomes. Next slide, please. So why is it so important? Well, for the reasons I think on the previous slide, but also because so many people, despite the improvements we've seen in healthcare over the years in the UK, a lot of people still live in very poor health and struggle with perhaps even more than one disease or condition. And this causes unsustainable strain on our NHS. As we know, there's the rising costs, the terrible waiting lists. Health professionals that we speak to say that if they had sort of seen people earlier or detected disease earlier, then outcomes for people and their families would have been so much better. Next slide, please. So ill health not only affects individuals, but also impacts our workforce and, of course, our economy, with people being out with long-term health conditions. And these health impacts are not always felt equally across our society. And at Our Future Health, we really want to ensure that people, especially from historically underrepresented groups in health research, which includes all ages, all ethnicities, and all socioeconomic groups, are not only included in the research, but also benefit from the results of the research in years to come. It means that our findings will be far more representative, accurate, and equitable. And this is why Our Future Health, we don't just want to be the biggest with 5 million participants, but also the most diverse health research programme that's ever been attempted. And we're certainly well on the way to doing that. And the mix of our participants currently is very reflective of the UK census in a lot of cases, but we still have a long way to go. So that's particularly important to us. And our volunteers represent people from every nation. So we're in all 4 nations, and from November we'll also be recruiting in Northern Ireland. And you have to be 18 or over and a UK resident to take part. So as I say, we're making amazing progress. And as of yesterday, the numbers are just over 2.5 million people have signed up to and consented to join the programme. They might not have done the full process, but they're on the way, which is absolutely amazing. And of course, behind every number is a unique person, a person with their own motivations for joining, whether that's because of a condition or a disease in their family, something they've experienced themselves, or even just to find out more about their own health. Okay, next slide. And now I'm going to pass over to Kate. Thank you, Kate.
Great. Thanks very much, Caroline. And as Abby mentioned in her introduction, I sort of lead on our public involvement and engagement work at Our Future Health. That sits within the ethics team because we think it's incredibly important ethically that we really sort of reflect on and learn from our participants, but also members of the public who are not participating in the programme as well. So we make sure that we weave this involvement sort of throughout our programme in terms of how we work with our participants and the public. What that means in terms of our structures is that we take a lot of sort of strategic questions to our public advisory board. This is a mix of participants, but also non-participants. There's around 17 of them. They're all from very different backgrounds. Some of them know a little bit more about health research than others. Some of them are very kind of, outside the health research world. And most of them are, to be honest. So we have that really kind of helpful sort of group that we can sort of take strategic questions to about how we should kind of think about participants' interests and well-being in the decisions that we make about our programme. That's helped by the fact that on the other advisory boards that we have as part of our governance at Our Future Health, for example, our ethics advisory board or our science advisory board, we make sure that we have a member of our public advisory board sitting on those boards too, just to make sure that consistently that kind of public and participant voices is heard throughout our governance structures. More recently, we have established an involvement network. So we were finding we were taking a lot of questions to the public advisory board that were perhaps less strategic and more focused on how we, for example, might need to kind of write something in a clear way for our participants. So we needed to kind of work out how we could not burden our participant advisory board further, but also how we could broaden the kind of offer of PPIE, participant and public involvement engagement at Our Future Health, through thinking about setting up an alternative and kind of complementary structure to the public advisory board. So this involvement network was recently piloted and it went really well, the pilot. It's a really good way that we can bring early ideas, questions, very light touch kind of, what do you think type approaches to this group of people. And again, it's a mixture of participants and members of the public. And how we've set it up in the first instance is that everybody who's a member on that group previously took part in an involvement activity that we've already run. So examples of those are towards the bottom of this slide, which include kind of deliberative dialogue. So this means kind of gathering a group of the public or our participants together to kind of really get to the hearts of some very complex issues that we're having to think about, really clearly as a programme before we begin to roll out any policies associated with those complex issues. So, for example, we've had to think about how we might offer additional studies to our participants in the future, how we can do that in a way that's ethical and kind of gives them the information that they need to know before deciding whether they want to learn more about those additional studies. And those might be run by researchers external to Our Future Health. But also when people join our programme, they join with the ability to be able to provide additional consent to get some additional health feedback based on the information that they've given us in the questionnaire, for example. So those were the sort of kind of really kind of quite complex questions that we thought required that very deliberative approach to kind of just exploring those with a wider group of people. We also have a team that is separate to me, but very much that I work quite closely with, who lead on our user design and research activities. And this is about really making sure that when we communicate anything out to our participants, when we need to tell them anything additional, or if we do anything different with our programme to that which is in our participant information sheet, and kind of adding as we go and making sure that we communicate really well, that we do that well through working with our participants to make sure that we do that clearly. And this all sits as well within this sort of ethics sphere. So, you know, throughout our program, as well as PPIE, is a really core ethics team to make sure that everything we do has that kind of ethics overview, that making sure, you know, we do this in the right way. And we work closely with our research ethics committee as well. So we're a regulated research program. All of this sort of weaving through activity is underpinned by our PPIE strategy. And Anna, if you can go to the next slide. So I just thought I'd share some of our commitments in the strategies. The first one I've just described, which is about embedding those public and participant perspectives in our internal structures. We also think it's really important not to kind of just devote loads of time to one particular method of involvement or engagement. There are lots of different things that we can do. So, for example, deliberation is one of them, but user design and research practices is another. But I think also what, in my kind of role that I'd like to do further is think about kind of some more creative approaches to involving and engaging our participants in the decisions that we're making and the direction of our program. So I think that's something that we're cognizant of and kind of hoping to work on with respect to our PPIE approaches. We're also committed to sharing what we learn with the people who contribute to our work. So this includes people who sort of directly take part in involvement activities, but also we need to work hard on kind of communicating out what we learn from these things and the kind of, the input that we have from participants in the public to wider groups. So this could be, a different webinar that we might have that sort of explores, what we've learned from a particular dialogue. But also, Our Future Health is quite a large organisation. There's a few hundred of us who work at Our Future Health. So as well as kind of, disseminating and kind of, sharing information out to broader audiences, it's also important for us to make sure that we're talking to our own team too and sort of really conveying clearly what we're learning from the participants who kind of contribute their views to our programme. Our Future Health's not an island. We sit in this kind of health research ecosystem. And there's lots of different actors, there's lots of different organisations working in it. So what we're keen to do again is to make sure that we're not keeping information to ourselves. We talk a lot with our with kind of organisations who are working in a similar sphere. So that might include UK Biobank or Genomics England. But also what I found really helpful in terms of our partnerships that Anna described is basically asking them how they do it. So for our involvement network, before I did anything, I talked to some, of our partners who have a similar network, and rather than reinvent the wheel, just making sure that I can kind of take those learnings on board. So it's very much a give and take, and is a really helpful approach for how we work on our involvement activities. And then finally, and really importantly, we need to make sure that we evaluate the involvement and engagement work that we do, so that we can basically continue to learn and improve how we sort of run involvement and engagement activities at Our Future Health. So I'll stop there and stop talking about PPIE. I could talk all day, and I'll pass to Anna.
Thanks, Kate. So I'm just going to talk to you for a few moments about what Our Future Health can offer in terms of advancing health through research. Caroline's already talked about the fact that we are designed to help everyone live longer and healthier lives through the discovery and testing of more effective approaches to prevention, early detection and treatment of disease. And so what that ultimately means is we are here to support and enable research that will deliver new discoveries that benefit people from all backgrounds and ensure that there are better health outcomes for everybody. So forgive me for a moment while we dive a little bit into the science. When people join Our Future Health and become participants in the programme, that we collect a large amount of data about them. So they sign up, provide consent, and then complete a questionnaire and provide consent for access to electronic health records. So that's hospital records, and in future primary care records as well. And so this data is stored and managed according to strict security standards, and it's managed within what we call a trusted research environment. That is this sort of highly secure online data storage system. And researchers can apply to study the de-identified information through that system. So this slide just shows what we currently have in this trusted research environment, in our trusted research environment. And you can see that there is a large volumes of data about our participants. I think Caroline indicated earlier that we have just over 2.5 million people who have joined the programme, and you will see here that the numbers are slightly different. That is because not everybody has passed through the whole process and are at different stages. So we have nearly 2 million baseline health questionnaires, and then some of the other data sets depend on how many direct links we can create, and some of the work that is still ongoing to bring in that data. But we have a large amount of data, both baseline health questionnaires, genotype array data, which is the genetic data based on blood samples that are provided, electronic health records, so that's secondary care, so that's hospital records, cancer and death registration data, and then information participant clinic data. So that is the information that we collect from participants at their clinic appointments, which Caroline will talk a little bit more about later. And then geographical data based on questionnaire responses. This is an image really that just shows how the scale and depth and detail of the data that we have will grow over time. So we make new data available for research in our trusted research environment every 3 months. And what this image shows is how that volume of data increases over time as new people join the programme, as the information about existing participants increases. So perhaps people have more hospital appointments, and therefore that additional information becomes available about them. But also as we add new data types. So for example, the geographical data, which we've been adding from our questionnaires, is new data that we have recently added. So you can just see these square boxes demonstrate the size of that data growing over time. And then just to touch briefly on the kinds of research that our Future Health could enable. So as Caroline mentioned, we've recruited a large number of people with significant geographical and other diversity, demographic diversity, including ethnicity, age, sex, and indicators of deprivation. And all of this will be enhanced as recruitment progresses and the new data comes online. But it is already a very rich data source for research. So we can, for example, help understanding the patient journey. So from making the process of getting diagnosed and treatment better. So this is looking at the steps that people take from having first symptoms to getting a diagnosis, and then what happens after that, making these steps as smooth and efficient as possible so that people can get the right care quickly, and using this information to predict who might get sick or whose condition might get worse, and taking action early to help people before problems become serious. We can help with using technologies to understand causal factors of disease and predict health problems earlier. So that means this is about understanding the main reasons or causes that make people sick or lead to health conditions. So for example, things like smoking can lead to lung cancer, or high blood pressure could lead to heart disease. And it also helps develop insights about steps that could be taken to stop those diseases from happening, like public health campaigns to encourage people not to smoke, and also ways to catch those diseases earlier. So there will also be possibilities to look at ways using the stored blood samples to look at ways that our genes affect the way we respond to medications and drugs. So helping to identify disease mechanisms and potential treatment targets, and also helping us to understand how health and economics are intertwined at both individual and national levels, helping to look at differences between groups of people in detail. So maybe looking at different groups based on ethnicity or geography or disease precursor conditions or disease risks, and that will help make better decisions and policies to improve everyone's health by making stronger and more reliable conclusions about health and disease and the policies and health recommendations and ensuring that policies and health recommendations are based on solid evidence that are fair for everyone. This is just a sort of snippet of some of the kind of research questions or research areas that could be supported through the data that we have. We are already open for research, and we already have a number of research groups from across the UK conducting research using our data, and we try to make that information as available as we can to both our participants but also the broader kind of public. So you'll see here we have on our website we have a news and stories section which includes information about research that is being undertaken using the Our Future Health data. And also provides kind of pieces about news items about the findings that we have from looking at the kind of data at an aggregate level. So some of the research studies that are already underway are looking either at kind of quite broad questions, so questions like, are there common factors for having heart disease or diabetes? And other chronic diseases at the same time, or similarly things like how can you improve healthcare for diverse populations and looking at risk for multiple long-term conditions. But equally there are some more specific kind of research projects underway at the moment. So for example, how does being physically active influence the way our genes or life circumstances affect our feelings of depression in midlife? It's quite a specific research question, and we have both types of questions, very broad ones that are looking at the data as a whole, and any much more specific ones that are looking at very specific questions or diseases or health conditions. And we do try, as I say, to make that information available. So if you're interested, there's a link here and you can go on and have a look. I just wanted to take a quick moment to mention for any researchers who might be in the audience who are interested in knowing more about how to access the Our Future Health data for your research, but we also have a dedicated researcher website where there is a lot of information about, a lot of detailed information, I should say, about the data that we hold and how to access and use that. So you can follow the links here to find out more about that. I briefly wanted to just touch on where Our Future Health may be able to offer benefits for EB research particularly. And I think just a few points really that I wanted to kind of pull out in relation to areas where Our Future Health can particularly benefit research into rare diseases and rare health conditions like EB. These points build on many of the points we've already made through the presentation, but Our Future Health does have provides several unique opportunities compared to other similar programs. So we are unrivaled in terms of our size and scale. So purely the number of people that already are and will continue to be in the cohort make this the size such that you are able to identify rare conditions in a way that may not have been possible in other cohorts. Similarly, the diversity we have, and so the ability that the fact that we are designed to reflect the whole of the UK population means that the research that can be undertaken will support, ensure that all people that the recommendations about health and disease that come and the research findings are fair for everyone. Having access to linked health records means that we are able to track how things progress over time. So we will be able to pick up new diagnoses as we go, and also hopefully be able to help identify information that enables diagnosis for those who are who either go undiagnosed or misdiagnosed, and be able to look at patterns across that. So there are many reasons that we think that the kind of unique components of Our Future Health make it really valuable for rare disease research. And I just wanted to touch very briefly on one of our funding partners that Caroline alluded to. We we work very closely with our funding partners who provide a lot of input into the programme sort of design and development as we go. And one of these is LifeArc. They are using their deep expertise to transform the lives of people living with rare disease and drug resistance infections. And they are really interested in the size and scale of our future health to enable them to do research into particularly rare diseases and developing treatments, providing infrastructure and expertise, and funding innovative research in these areas. And I believe they have had partnerships with DEBRA before that have led to really beneficial outcomes. So we really look forward to continuing to collaborate with them to ensure that we understand and identify and are able to support research that can intervene in the rare diseases space. I just wanted to draw very quickly on a quote from Sam Barrell, who is the Chief Executive at LifeArc, which I think kind of demonstrated this really beautifully. So she says, "We will look at this cohort as it scales in size and links with other data sets and work out if we can genetically identify those who may not yet be diagnosed with a rare disease, and then provide them with the right support and the right potential access to groundbreaking clinical trials and therapies." I think that really nicely summarises the benefits of our future health for I hope all people, but particularly those who have a rare disease or rare health condition. Right, we're going to just close very quickly with a bit around what taking part involves, and I'm going to hand back now to Caroline to talk about this.
Thank you, Anna. Yes, so you might have been thinking, how can I take part? What does it involve? What do I have to do? So the next section will talk you through that. And we're going to begin with a little video. So this was actually created when we hit 1 million participants, so a fantastic milestone. That was 1 million participants that have completed the whole process. So this will give you a bit of a flavour. So fingers crossed.
NHS has helped me and my family out enough. I think it's time to give something back.
I chose to sign up to Our Future Health because I ask myself every morning, how can I serve society?
Not much skin off my back, such a small time out of my day to participate and give back what I can.
I have a lot to give.
I have a lot to give.
I have a lot to give.
Brilliant, thank you. Okay, so if you wanted to sign up, how does that work? So to start with, we ask our participants to give their consent. What that means is that any health data that we collect from you can be linked to the NHS records. There's a health and lifestyle questionnaire. So we'll learn more about the impact of people's lifestyle on their health. So things like, have you been a smoker? Is there any history of certain disease in your family? Then we look to ask people to book an appointment at one of our clinics. And the clinics move around the country. We have these mobile units in the photo there. We also are in a number of Boots clinics. So it might be that when you sign up, there isn't actually an open clinic near you at the time, but we will contact you if you sign up when there is a clinic open in your area. And at the appointment, we take a small amount of blood and some physical measurements. And you'll have the chance to learn more about your own health at the appointment. So, for example, your heart rate, your blood pressure, and your BMI. We also offer a £10 shopping voucher in recognition of the time and effort that it takes to volunteer. And this really is with the aim of removing barriers for those people that perhaps are on lower incomes. It might prevent them from joining the programme. So we want to make sure it's as successful as possible. And then finally, we ask for consent to contact people at a later stage with the opportunity to take part in perhaps other research studies, as well as the option to receive more information in the future based on the analysis of the questionnaire and the blood sample. And that's purely if they would like to receive it. So absolutely no pressure to do that. And next slide, please. So if you wanted to find out a bit more, it's quite a simple process. You go onto our website and go to the Taking Part section and click through, and it's quite easy to follow the steps. So there's a link there. Next slide, please, Anna. And then we're very fortunate that a number of the people that have signed up to become a volunteer have been keen to share their motivations for joining the programme and have shared their stories with us. It could be something that is in their family, that they want to prevent future generations from living with. It might be that they're the researcher themselves and they want to talk about the work that they're doing. And there's some really amazing stories there. So you can again go onto the website if you're interested in learning about more of those. And next slide, please, Anna. And we'd love to hear from anyone in the DEBRA community. Perhaps you have signed up, or perhaps you're considering signing up. And if so, you would like to share a story with us about your family or yourself. It's, you know, entirely up to you. But I've put a name of our one of our content editors there, and you can also obviously contact DEBRA to be put in touch with either myself or Anna. But we would love to hear your story, and I know DEBRA also would be interested. So that, next slide, and I think I'm passing now back to Anna. Thanks,
This is just a very closing slide, really. Thank you, Caroline. Just wanted to say a kind of huge thank you at the end to all of our partners, without whom none of this would be possible, and by which we mean both our funding partners and also our affiliate charities and a number of partners from other sectors, so sports, retail, and the government people group who we work with to help support recruitment. That's not to say that there are not other people that we work with. We also work with, you know, the NHS, and most importantly of all, the general public who take part in our programmes. So this is just, you know, an opportunity to really to recognise all of those contributions and say a huge thank you. And thank you again to DEBRA for their ongoing support and for inviting us to speak today. And with that, I would just say thank you again, and we are very happy to take any questions. I might try and stop sharing.
Thank you for that, Anna and Kate and Caroline. So really very interesting. I know I had just a couple of questions from myself, because having participated, this probably isn't possible. Can I track where I am on those squares? So when I first filled in the questionnaire, I'm up in Middlesbrough. The nearest place to donate my sample was in Leeds. It was an hour-and-a-half drive. I filled in the questionnaire and then sort of gave up and forgot about it. But I realise now that I would have been represented as the questionnaire data. And then at the end of last year, when they opened one at the Boots near me, I went and gave my sample. So do you let your participants know where they are, or would that just be too much like hard work for over 1 million people?
That's a good question. Kate, do you want, I don't know if you can talk to the detail of it, otherwise I can.
I think you're probably better placed than me.
That's fine. I mean, I would say that the short answer is we can probably track you through the system, because you will have a unique identifier in the background and we know where you are in your recruitment journey, but we don't directly provide that information directly to participants. What we do from time to time is look at trying to encourage people through that recruitment pathway, because it is extremely useful and beneficial to have people sign up, give their consent, enable linkage to health records, and to complete the questionnaire is hugely important in terms of the data that is available for research, and therefore to support to identify benefits for health in general. And then the more data we have on individuals, the better, in terms of more types of research that can be done and the more potential benefit to you as an individual. So we do try and encourage people through that recruitment journey. So from time to time we will do, we may mail out to you, for example, and say, you know, there is a clinic now open in your area. please come along.
Yeah. No,
so
that makes perfect sense. Yeah. So if I'd got stuck,
not direct, you are here in the journey, but you will get a follow up.
If I'd got stuck and forgotten to do one bit, I'd be let know. So that's, yeah, it did seem very efficient for anyone considering doing it. It was a very simple process. I did have another question. This is more from the researcher side of things, which is about obviously the diversity of your cohort is like a big selling point of it. Do you know how representative you currently are of the UK population in terms of sex and ethnicity? I know.
It's a really good question. We track it all the time. So, you know, day to day, we are tracking it against the latest UK census results, which is, you know, you have to take a baseline, and that's the kind of we are pretty close. It fluctuates a little bit day to day, and as we have rolled out recruitment, so we started first in England, then we launched last year in Scotland, and then in Wales, and we will be launching in Northern Ireland later this year. So it moves a little bit in different categories, up and down, but we are fairly close to targets. And within that, there are some variations, but we are a little bit under in our younger age groups.
Okay.
Interestingly, we are a little behind in the number of men taking part.
That would have been my guess. I was going to ask you. I was going to send that one over to Kate on the PPI front, because we know that women often get involved more with things.
Yes.
So yeah,
but it's not as skewed as you might. It's not as skewed as you might think. Yeah.
Oh no, that's excellent to hear. I think. Yeah, I guess just one more question for me. I think if anyone's got any questions to put in the webinar chat or the Q&A, I can't see anyone coming in at the minute. It was very comprehensive, everything, the information that you've given us. I'm just asking now, will you be able to keep going if you hit that 5 million? I don't know how your funding works, but would it not be tempting to just ride the wave and keep going until you've got, I mean, it's a significant percentage of the population.
It's a really interesting question. I think I think that, and there's a lot of information actually in the study protocol, but I think we are aware that, you know, with 1 million, 2 million, 3 million, 5 million, there are already huge benefits as you go through. And I think 5 million was chosen as a kind of significantly ambitious but optimal sort of number to aim for. I think there are lots of ways that we can enhance the data that we have through adding additional linkages to additional data sources and data types, renewing the questionnaires, getting people to update their data on questionnaires, for example, adding new questionnaires that might cover new aspects. So I think what's much more likely is that we will invest in expanding the data that we have available for the individuals involved at 5 million rather than going beyond that.
That makes perfect sense, and it feeds in quite nicely. We've got a question in the chat about the consent. So presumably, if you wanted to expand, you'd need to go out to people and ask for further consent. And we've got a question in the chat regarding the consent. Would participants be able to review what they've consented to? I think that's what is being asked. Regarding consent to link, would we be able to review what encompasses? So I think people are asking whether they can see what they've consented to. Or maybe even withdraw, or
yes. Kate, do you want to take
yeah
this one?
No, so this is all of the kind of information about, well, there's a separate consent form. I'll put these things in the chat. I'll put this to everybody. There we go. So one is the participant information sheet. So this gives participants a lot more information about what sort of elements of consent when they sign those consent forms actually means, the sort of detail behind it. So I'll add that in as well. And the consent form itself is also available on our website. So these are things that, you know, if you do consider joining the program, you can very much kind of like read separately on advance. You don't have to sort of click on anything to read these things. They're very openly accessible. And I think in terms of like anything changing, so we, as I said, during the presentation, we work quite closely with our research ethics committee. So anything that is different or added to our participant information sheet has to be quite a high bar about why we're doing it, what the rationale is, and then the research ethics committee kind of really scrutinise what we're doing. We're also guided by a research protocol, which again is available on our website, and we're currently in the process of reviewing this because it's a longitudinal programme. It's over a long period of time, so what tends to happen is because of how our approval works with the Health Research Authority, every 5 years, we have to think about what our protocol says and whether there are any kind of significant changes. And then we needed to go back to our Research Ethics Committee to get their approval. So there's this constant kind of thinking about whether anything changes. There's a real kind of clear regulatory process that we have to go through to make those changes. With the consent, where there's, you've got the things that people have signed up for, we can't really deviate beyond what people have signed up for. So we're quite kind of have to be very aligned with what the consent says. So for example, Abby, you as a participant, if we ever want to offer you health feedback, as Caroline was saying, what the consent says is that we will ask you before giving that to you. So that would mean that it has to be a process where we offer that before you accept and consent to that additional thing. So there is a layered approach to consent as well as the things that are currently set out on our consent form.
Okay. Thank you. It does seem very, it felt safe. I don't know whether but it felt very, it felt safe to do. I had a question again based on EB. If DEBRA as a charity was interested in how many out of your 5 million or out of your 1 million or out of your 2 million participants were perhaps carriers of genes known to be responsible for EB, would that be a research project that we would fund a researcher to come to you to do that analysis? Or would we be able to approach you directly and ask you to mine your own data?
So at the moment, the way we're set up at the moment, it would be that would be a research application to our future health. It depends a little bit on what the question you're asking. If you're just asking how many people, if it's just a number, we might be able to do some simple feasibility study type questions for you. But it would be a research. We would require a research project to come in through the standard processes to do that. Our future health doesn't have access ourselves to do research on the data. We also have to go through our independent access process because it has to be fair and transparent, and there have to be no conflicts about that because we have to be extremely careful about who is able to access that data and that they are using it for the right.
That makes sense. You're not dipping in and out yourselves to
in the longer term, it may be that is something we can do more of, but at the moment it's very restricted access to using the data, and it's through an independent process to assess.
Thank you very much for that. I'm just checking to see, we haven't had any questions in the Q&A. I'm just hoping it's working. I know the chat's working because we've had that.
I wanted to just add one point to what Kate was saying earlier around consent, because I think you specifically mentioned it, Abby, and rather than overlooking it, we do also have a process that allows participants to withdraw their consent. So if they no longer want to be part of the resource, and there are kind of different layers, as Kate says, in the same way that there are different layers to the consent, there are different layers to withdrawal. So you can partially withdraw, full withdrawal, etc. So we make sure that is also there as part of our consent, and I guess as part of ensuring that the programme operates ethically.
Thank you. I mean, it's been very, very informative, absolutely brilliant. I'm going to bring us to a close now, and thank you all again. I've put a note in the chat if anybody can leave some feedback for the speakers, and the link if you want to register for our next webinar, which I'll just put up there on the screen, which will be the 5th of November, which is bonfire night. I hope everyone can still make it. It's an 8 p.m. one. But yeah, I would love to just say thank you again. Thank you very much to Anna, Caroline and Kate for spending their time to come and talk to us about our future health. I hope we get some people living with EB taking up the opportunity to get their samples into the database. And I hope we get some EB researchers also coming forward to try and have a mind through some of that data. It'd be absolutely fantastic. So thank you again, and thank you to everyone who attended.